Dear Medicos, we are having the honor to have Dr. Kritika with us, rank 5555. Yes, proud moment for DAMS family. So, beta, we congrats you.
Thank you so much, sir.
And how you're feeling after this?
The feeling hasn't sunken in yet. Mixed emotions. So yeah.
Top 100 rank, but this is a lifetime achievement. I feel like you are appearing for this PG entrance exam and you are getting this in very first attempt. That's great, beta. So now I want to share your success story with all the juniors, all the medicals listening to you on this platform. So beta, you join our DAMS Mumbai Center in which year, beta?
Yes, sir. So I am a post intern right now. I joined DAMS back in 2019, which was my third minor year with foundation course, and started with live lectures, face-to-face lectures. In my third minor, which shifted to online lectures back during the pandemic in my final year. During my preparation, I didn't really solve any MCQs during my MBBS years. My main concentration was on just understanding everything, attending lectures, making notes, and just like getting the concepts.
So, but in the third year, when you were attending all the lectures, how you manage like your college, parental college is Sethi Medical College, Mumbai.
Yes, sir.
So how you manage like all the classes, weekend classes with your college schedule, beta?
It used to be tough a little, but somehow we managed it, all of us, all my friends and my batchmates. We had to miss a few lectures here and there, but then in the final year we had online lectures, so that was quite easy with the lockdown. And
so beta, you have used this word, I have written all the notes. So you have written your own notes in face-to-face in the third year, and in the final year in the lockdown period, you have used our live. So how was what is the role of those self-written class notes in this rank of 55?
I think they play a very important role for revision, for subsequent revisions. It was pretty easy. I knew where everything was. I had a photographic memory of everything. So it made my life pretty easy. And I don't think so printed notes would could replace those handwritten notes.
Like, beta, you were attending all the college classes at Sethi Medical College. So where you rate, like you attended our DAMS classes, what do you feel? The concepts you learn in face-to-face, the classroom learning, what was the role of that classroom learning in this success?
I could ask doubts whenever, at the same time, I didn't have to wait or message any professor. It got cleared right away. And I could make my own side notes, which was, I think, they play a very important role.
So, Beta, you have written all the class notes in third year and final year, and you were saying, honestly, you are telling everything. I have not attempted any MCQ during the college time. And it may be possible because schedule is not possible to attempt MCQs. So when you came in the internship and post-COVID, when you attended our T&D, test and discussion course, how was the experience of that T&D, Beta?
So during my internship, I decided to take a break. So my dedicated preparation for NEETPG started last year in May 2022.
Okay.
Post my internship. So for about 9 months, I had a dedicated preparation. And that's when I started solving MCQs, DQB with my first reading. For my first revision, I did it along with TND, which helped me. And it was like a massive game changer for me because I realized my mistakes, where I need to concentrate on. So TND played a very important role. And in the last 2 months, I was pretty regular with GTs and made sure that I was improving rather than just focusing on the result of my rank in GTs.
Where you rate, beta? Where you rate TND MCQs, GT MCQs against last NEET examination?
Sorry, sir?
How you compare the level of MCQs we are giving you in the TND in your GTs against last NEET?
TND was almost equal to the NEET PG, I felt. GTs and CBT were a little difficult, which was good because it helped me, it helped with my revisions pretty well.
So now, better, like after getting this rank 55, I feel that you are the best student to guide all the juniors, all the students listening to you. What do you feel like out of 19 subjects, what should be the strategy? Like you are a mature student now, as a post intern, you are getting this rank, pass out from one of the best institute of the country. Now, what do you feel? Okay, what advice you will give, share to your juniors listening to you? Better, which subject should be given more preference? What should be the strategy?
I feel like people should focus on PSM and OBGY the most, along with short subjects. Surgery and medicine, you can't get all of the questions right. You just focus on the notes, make sure your concepts are right. And for people who are in MBBS, I would tell them not to read those guidebooks. I haven't read a single guidebook throughout my preparation. And solve those GTs regularly. Don't focus on the results. Just focus on that you're improving. And I feel like there's a lot of noise everywhere on social media with different strategies. I don't think so any particular strategy would work for anyone. It's just being consistent and disciplined in your preparation. That's what is important.
But Kritika, what I feel ke last 2 years was a competition between the quantitative learning and one is your concise quality learning of DAMS. Where you rate better, like one you are having thousands of hours of attending, and one is you're coming to the classroom. So where you keep the concise class notes in success. Okay, what the student should
you have to keep it concise. You have to keep it concise. You can't complete the portion. It's a lot. No one can complete the portion. No one can get 800 out of 800 in this examination. You just have to keep it concise and just have multiple revisions with it.
Like you're saying you should give more preference to the PSM or your gynae obs and short subjects. Like if you come, many students, what I observe, many students they run, okay, we have to go in the depth of each and every point of medicine, surgery, which are very exhaustive, what I feel. So where you rate, what percent of our time preparation should be given to big subjects, like medicine, surgery?
Big subjects like medicine and surgery, I would say during your MBBS, if you have made sure that your concepts are clear, especially for medicine, pharmac, physiology would cover most of your medicine and even pathology. So during your MBBS, you just make sure that you read the textbooks rather than the guidebooks for medicine and surgery. I think it would pretty much cover up the concepts part of it, and it would make your life pretty easy for your preparation.
What I'm getting from your words, we should focus more on the basic sciences. Like my first year, second year is very strong. So no need of going in each and depth of each and every point in medicine, because it is better we should focus on the basic sciences. Where you keep these patho, pharma, micro in your rank 55 beta. What was the role of these subjects in your rank?
For these subjects, I think I made sure that my second year subjects and first year subjects were done pretty well during my MBBS. So it was not tough for me during in the last 1 year. So.
And coming in the last spell, like when you went for DVT, how was the experience of that DVT in your examination hall?
DVT, I had attended DVT in December. It was a fun revision itself. And in the last 1 week, I had gone through everything, all the subjects. It is impossible to go through your notes in the last 1 week or 10 days. DVT made sure that you could at least touch upon the important facts and you remain calm during your on your examination day. So that you just feel that you have you have gone through all the important points of all subjects. I think DVT was amazing.
What I'm getting from your words, like our own written class notes with TND, with DVT, that was more than sufficient for attempting all that difficult. Because last NEET, what most students were saying was atypical paper. How was your experience? Where you rate the last NEET exam, beta? Moderate or it was on the toughest?
NEETPG 2022.
2023.
I had given the examination with 2023. I found it moderate. Few questions were difficult. The options were pretty close by, rather than the questions and the topics being difficult. The topics were from important topics itself. So yeah.
And beta, what was the experience of PYQ, like previous year questions we organized in the last few days when you appeared for that PYQ sessions?
to be honest, I couldn't complete PYQs in the last 1 week. I couldn't go through the videos that DAMS had come up with. I had gone through a few subjects, but then I didn't have the time. I just focused on completing my revisions and DVT.
That's great. And when, again, we are proud to have rank 55 with us, and she's sharing very, very honestly. She's telling you don't never skip your textbooks, work hard on the basic sciences. Apart from academics, like what was the role of DAMS family in your preparation?
I think I would like to thank Sumir sir. His motivating videos were just life changing. And in this last 1 year, I've just realized the importance of discipline, not just for this exam, through any thing you want to achieve in your life, you have to be disciplined.
But any special
I
message?
think this is something I would take with me with this examination.
Any special message for your family, for your parents, because of whom you are here on this platform?
I would like to thank all my family members, friends, and teachers, and everyone from DAMS faculty. They have played a very important role. And I think most importantly, the patients that I've come across during my MBBS, I think they played really important role unknowingly.
Any special message for the juniors, beta?
For people who are in MBBS, don't read the guidebooks. They are not going to help you. I have not referred a single guidebook throughout my preparation. Just read the textbooks, make sure concepts are well. Don't bunk clinical postings. They are really important.
It's very, very, very true words. Okay, we should not miss out any clinical posting, beta. Thanks a lot for coming on this platform and sharing your success story, beta. We wish you very best of luck for our DAMS family, and we are confident that you will excel in your life, beta. Thank you.
Thank you so much, sir.
Thank you.